and welcome to the Senior Advocate Caregiving Series sponsored by Commonwealth Assisted Living. This series is made up of 5 short videos to help those caregivers at home dealing with loved ones with dementia. Today we're going to be speaking about understanding and recognizing dementia, and we're thrilled to have Jeff Gruber, who is the Director of Memory Care at Commonwealth Assisted Living. Hi, Jeff.
Good afternoon, Stephanie.
Thank you for coming.
Thank you.
I wanted to talk a little bit about Alzheimer's. We've heard a lot about that in the news lately. Is there a difference between Alzheimer's and dementia?
Stephanie, there is. Dementia is basically a broad umbrella word that is commonly used to describe several diseases as well as processes. Dementia, once again, is also used to describe a series or a cluster of symptoms that a lot of the medical professionals use to actually narrow down a diagnosis, which is commonly Alzheimer's.
How do we know if someone has dementia, and are there signs or symptoms to look for?
A lot of the healthcare professionals use 4 signs and symptoms. Most commonly, they use memory loss, loss of reasoning, loss of thinking skills, and then poor judgment. Unfortunately, 1 in 3 families are actually dealing with some form of Alzheimer's or other related dementia.
And is memory loss part of the natural aging progression? We hear sometimes the word senility, and so we assume when people get older, they will start forgetting things.
Stephanie, it is not expected that as we age in place, every senior will be diagnosed with Alzheimer's or some form of dementia. As we age in place, several of us are going to be having senior moments, but that does not mean that we will eventually have Alzheimer's or dementia. As we age in place, our learning skills become slower, and it may take us a lot longer to do a task, but it does not mean that we will not be able to successfully complete the tasks of daily living.
How is one diagnosed with dementia, and is there a cure?
Unfortunately, there is no cure at this time. Visiting your family physician whenever a loved one is noticed or a family member recognizes, memory loss, which could be having a resident or a family member repeat the same question, or if a family member notices that there is poor judgment skills being used, for example, going out to the mailbox without a coat or shoes on. Those type of symptoms might encourage the family to take their loved ones to see a physician.
Is there a way to manage those symptoms with medication?
Yes. The common medications that are commonly used are Aricept and Namenda, which will initially slow down the disease process. But there are also other tools that can be used successfully as the family member ages in place with the disease process. Medications will no longer be effective, and that's where you have to start using some alternative techniques.
Which will lead us right into our next video, which will be on using life experiences to help navigate dementia. This has been Jeff Gruber with Commonwealth Assisted Living, Stephanie Smith with Senior Advocate. Thanks for joining us.